Hey everybody, Dr. Sulera here. In this module, we're gonna go into detail as to what is the difference between the regular blood work that is done in a regular doctor's office versus the blood work that we would do at Thrivemed, and is years and years away. I mean, it's literally black and white, and I'm gonna share with you why that is. And so basically, we're trying to understand what the difference is between, hey, your regular physical exam when they're using this stethoscope, and look, I use that stethoscope in the hospital every day, but it's very limited amount of information. What the difference is between that and using a digital twin, which is a digital companion for somebody throughout their whole life to tell them and to help them understand how can they optimize, feel better, perform better, but at the same time, how can they go through some of the hardest times in their lives and helping them through that moment and avoiding unnecessary suffering, catching things as early as humanly possible. And so first we're going to start with the heart. Regularly, when you go to your doctor's office, they are basically checking a CBC, which is called a complete metabolic panel, a complete blood count, and then the CMP, a complete metabolic panel, and then lipid panel. That's basically what most doctors just check. And so in Thrivemed, we're going into detail, and I'm not going to bore you with everything that is included, but basically there's two other numbers that are rarely checked in a regular doctor's office. This is called the apolipoprotein B, and then the LDL particle number. The apolipoprotein B is a little particle that is in all of the fats in the body, the bad fats. So if that particle is higher, you know that there are a higher risk for inflammation, heart attacks. And the particle size, the smaller these particles, then more risk of heart attack. So basically, what people would be missing if they don't check this test is that there is subtle risks. There is silent decline already with this apolipoprotein B and with the particle size. And if you're not checking it, it can go unnoticed for years. Now let's move into the thyroid. Most doctors don't check the thyroid unless there are problems. And usually if they do, they say that they only check, what I was trained is, hey, check only the TSH. But if it's abnormal, then you check the rest ones. Well, sometimes the TSH is normal, right? And so Thrivemed includes more testing, but the key test here is that we also include the free T3 and the free T4 and the thyroid peroxidase. Because people, if they don't check this, they would be missing, if they're having symptoms already like poor hormone conversion, fatigue, autoimmune thyroid disease, and it might be overlooked, leading to depression, anxiety, hair loss. So very, very important. Now let's move into the cancer detection. Most times, I recently just had a father of a doctor that had a biopsy when it wasn't needed. Now, they did 15 biopsies at the same time of the prostate. I don't know why they did that. The poor guy ends up with a massive infection from that biopsy. The infection goes into his blood, causes severe fever, and from this fever, he gets brain damages and heat strokes. He is in the hospital for months. Now, this is not needed if you get extensive panels. So what would be missed if you don't get the PSA percentage free and the PSA free, which is more specific than just the PSA, you could end up having something like this. And so it's important to check that too. Now, in terms of autoimmunity is rarely actually tested in regular blood work because our doctors are not really trained to do it. They think it's just too far out and is rare, right? But the truth is that many people have abnormalities. In Thrivemed's panel, we include a bunch of things that are there in the screen, but the two key things is that we do ANA titer and rheumatoid factor. Now, early immune attacks like severe joint pain and even loss of memory and things like that, and mainly joint issues, but it could be like so many different things that are happening in the body. It could be so many symptoms, tiredness, you name it. The autoimmune system can result in it. And so fatigue, joint pain, or other organ issues, if they are not doing these two tests, that could be missed, right? Now, immune regulation. Now, this is not usually tested. The only ones that test this is the CBC, the complete blood count, And that's just like a very basic understanding of, hey, are there enough bloods in the body to fight any infection? But we also do the CRP and the lymphocytes, which tell you a little bit more about the immune regulation of that person. And if they don't do it, chronic inflammation, immune weakness, increased risk of allergies, all of that could be overlooked. Now let's go into female health. Usually they test estrogen, sometimes follicle stimulating hormones, sometimes luteinizing hormones, but most of the times regular doctors actually don't check these hormones unless they are really having a patient that is advocating for themselves. So in Thrivemed's panel, we include a lot more, right? But there is two key things: the anti-Mullerian hormone, which assesses for ovarian reserve, and then the free testosterone in women, in men too, because that tells you exactly how much testosterone is available in the body. So if these tests are not done, people could be missing polycystic ovarian syndrome that leads to obesity, pain, all types of symptoms, decreasing energy and mood, and it could lead to fertility challenges. So that's why it's so important to make sure that those are tested. Now, in the male physiology, rarely doctors check testosterone. It sounds crazy, but it rarely happens. Regular doctors, but if a doctor is understanding the importance of this, they are gonna check it, but it's very few and in between. And so in Thrivemed, we are gonna check a bunch of blood work with a specification of male physiology, right? The main two tests are the free testosterone and estradiol levels. Estradiol levels are very important. They usually thought of as a female hormone, but they're really not. It's just a different molecule in the body that increases and causes balance. And it's really important to know the numbers of these two. And so if it's usually missed, you can have muscle loss, you can have men boobs, you can have a belly that you cannot get rid of, all of this. Now, metabolic. A lot of times, doctors will check only the A1C. And that's about it. Most doctors don't go any far past that. And I've spent a lot of time understanding diabetes and metabolism because it's one of the key things that really get people. Now, many people are on insulin if they're diabetic. The truth is that many people don't need to be on insulin. You see, most of the people on diabetics are type 2 diabetics, 80% of them. That means their body's still producing insulin. So why are you giving something to the body that the body's already producing, right? And so these people stay on insulin for years. And if you look at population studies, if people are on insulin, they have higher mortality. They die younger. So type 1 diabetics do not produce any insulin. They need to be on insulin. It will save their lives. But most people, out of 100 people with diabetes, 85% of them, 85 of them have type 2 diabetes, and they could come off the insulin. Now there's one test that can tell us that. That is the C-peptide test. The C-peptides will tell us whether somebody can come off insulin or not. And you can do it safely. And it will improve their lives, and it will help them lose weight because insulin is a growth hormone. So when you get them off of it, they lose weight. And then the other test that we will be checking is also leptin. Leptin regulates appetite. Sometimes it goes undetected. And this is the one where people don't feel like they're hungry. So it's really important to check it, and no doctor is really going to check this. Now, in terms of nutrients, most of the times, nutrients are not checked in your regular lab work. The only ones go with the kidneys, like sodium, potassium, but micronutrients like vitamin levels, things like that, is only if patients really ask for it for the most part. Sometimes they do, but they're not including a lot of things. But we are including homocysteine, specifically these two key ones, homocysteine and omega-3, which, if they are not done, high homocysteine levels will increase the risk of heart attacks. And omega imbalances, you name it, risk of heart attacks, strokes, all of this, if the omega levels are not optimized. So very important two things to check. Now, stress and aging. Some people, no doctors really test for stress or aging. That is not happening in the current healthcare model because of many reasons. But not to get into that, in Thrivemed, we check for other things that give us an idea of how much stress and aging is happening. And so the key two here are the biological age, which uses epigenetic age, and then the DHEA. And this tracks how the adrenal system is working. And if they don't do it, you have accelerated aging from stress, from hormone dropping, missing opportunities to actually reduce fatigue, feel more vitality. Now let's go into the liver. Most of the times when the doctors do, the complete metabolic panel does include some liver numbers, ALT, AST, bilirubin. In Thrivemed, we do more extensive work, and we're going to include the GGT and also globulin, because it's important to understand if the liver is working. And so many people now with fatty liver disease, their liver is starting to fail. And it's actually overcoming how many people are having to have transplants. It used to be alcohol, but now it's fatty liver disease. And it's all sugar that has been accumulated into glycogen stores in their liver. 50% of the US population has fatty liver disease. So if you're in a call with somebody, chances are they have fatty liver disease, 50-50, right? So it is a major problem, and it's actually becoming the leading cause of liver transplant in women. So it's very important to know this number. Now, the kidneys. The complete metabolic panel that is usually done does include the kidneys, the BUN, the creatinine, all those numbers. But in Thrivemed, we do more extensive. And one of those, the two key ones, are the urine albumin. And that tells you that the kidneys might be failing, that they are not doing their job as a filter, and that the protein is leaking out of that filter. And so it's not doing their job well. So people get swollen feet, swollen face, they accumulate liquids. And so it's important to know this number. And also the BUN and creatinine ratio allows you to see how well the body is maintaining and filtering toxins from the body. Now, in terms of the pancreas is not checked in your usual physical exam because of many reasons that we're not gonna get into here. But in Thrivemed, we do check the pancreas because some people have chronic abdominal pain, and this is a key. The amylase and the lipase are important because they digest fat. They're literally like little machines that are breaking down fat. So if you don't check these numbers, you could be missing the opportunity to tackle early pancreatic irritation. If you're drinking too much, things like that, or eating too much fat. Now, heavy metals. Heavy metals are never tested. I can tell you how many times, even in the hospital, when I order them, people tell me not to order them because they're too expensive, because of this, because of that, even in the hospital. So they're not usually tested unless there is like a really high risk. If somebody comes from Detroit, from one of the schools where lead is known. But many people still have lead and mercury levels that are high. And if you don't check them and they are high, you're literally losing a life-saving opportunity from fixing this issue. Now, let's go to the blood. The regular blood work in the doctors do include complete blood count, and they do have, how many cells are fighting infections, all the different types. But in Thrivemed, we actually go into more detail about this, and so the cell sizes and the platelet sizes go into detail about how their red blood cells and their blood is actually working. So some people, if they don't recreate these subtleties, they don't never understand why they're so tired. Now, in terms of electrolytes, most doctors, when they check that complete metabolic panel, it does include the sodium, the potassium, the chloride. But in Thrivemed, we go a little bit more into detail because the magnesium is never checked. And magnesium is so important for being able to understand if somebody's able to sleep or not, if they're tired of night, they get cramps or not, abdominal pain or not, you name it. Now, in the urine, most blood work and most physical exams do not include urine tests. Now in Thrivemed, we're going to include a bunch of urine tests because that tells us how the kidneys are actually working. So if we see anything like granular cast or RBCs, red blood cells, that means that the kidneys are not doing their jobs at filtering what needs to be filtered. And it's important because you would be missed the opportunity of like kidney stones, allowing them to get larger than what they need to be, that you could deal with them in a simple procedure, some cancers, infections, bleeding risk, and kidney problems. So a major problem. Now, biological age is not checked in your regular doctor's office. This allows us to see if people are just accelerated in the way that the body is decaying. And definitely we do not want to miss an opportunity that allows us to do that. And so these are all of the blood work that we are doing in the first panel of Thrivemed, and how it is so different from a regular panel. I mean, it's like black and white. Literally, you have so much more information to be able to help people understand their own bodies. And once they see those numbers, they can make decisions easier because they are seeing those numbers. It's not guessing work. All right, everybody. Dr. Z here. Take it easy.